Acquired immunodeficiency disorder and dementia appear to be two distinct disorders. However, the reality is that the former greatly affects the latter. In this slideshow, we will go over what exactly this relationship is, how it develops, its progression, and the treatment options for those affected. One must contract HIV for it to later develop into AIDS. The human immunodeficiency virus, or HIV, is a pathogen that most commonly resides in an infected individual's blood. The Center for Disease Control and Prevention outlined three separate stages that exist. Firstly, in acute HIV, the virus becomes present in a large quantity. Those affected may develop flu-like symptoms. Chronic HIV then follows and is characterized by a decline in the rate at which the virus replicates. Moreover, people become asymptomatic by this stage, but the virus can still be spread. A proper HIV medication protocol can prevent further progression onto stage 3, which is deemed AIDS. This is when the condition is most severe, and it occurs when the immune system is greatly damaged. CD4 cell count falls to under 200 cells per cubic millimeter by this point. This allows for many opportunistic infections to manifest. Throughout this process, HIV infects glial cells. This promotes inflammation and contributes to the cognitive decline seen in infected individuals. Now for development. One is affected by the virus when they interact with someone who already has it. Even since its earliest stages, it travels to the brain. Infecting the region promotes inflammation and gradual cognitive impairment. The picture depicted on the top of the slide shows an MRI scan of an infected individual. This contrasts the MRI scan in the bottom, which is of a healthy brain. What's most important here is the juxtaposition between the T2 scans of both pictures, and this scan can be found to the right in both images. T2 scans highlight fluid in the brain by illustrating this white contrast. Individuals with HIV evidently have more fluid because of all the inflammation that occurs. This creates a more compact space, hence leading to cognitive complications. These effects are expedited with alcohol and substance abuse. Some acute HIV symptoms are illustrated in this image to the right. Among the many symptoms are mouth ulcers, fatigue, and fever, just to name a few. In terms of treatment options, zidovudine was the first antiviral medication to be approved for HIV. Recent research has contributed to the discovery of more effective medication options. Viral infections are often difficult to treat because of how greatly their structures differ in comparison to those of living things. Nevertheless, some alternatives exist for lessening the effects of HIV. Therapies, counseling, and lifestyle changes are among some of these options. By far, the best measure to take is to prevent becoming infected, and these are my references. Thank you.